Welcome to the tutorial ACO Preventives and Quality Measures Flu Vaccine. Flu vaccine documentation is an ACO preventive health quality measure. In these tutorials, you will understand the flu vaccine quality measurement calculation, learn how to properly order and record details for flu vaccines you administer in office, and you will learn how to properly record historical information for a flu vaccine patients receive at other locations. This quality measure is met based on the following ratio: a denominator that equals all patients 6 months old and older who have been seen between October 1st and March 31st of the reporting year, where the numerator equals patients that have received an influenza vaccination or reporting having it done since August of the reporting year during that flu season. Vaccination quality measures can also be met when you document a patient's vaccine history. If the patient provides you with information regarding their flu vaccine, you can record that as a historical immunization. From the patient's chart, go to Immunizations. The Immunizations window displays, and you will click the History button. The history form displays. The first thing you must do is select the immunization that you are documenting. You will do this by clicking the Add to Selections button. An Add to List of Immunizations window displays. If influenza is not displayed, you will need to click the All Vaccines button. Scroll through the list and locate the influenza virus option. Right mouse clicking on the option will allow you to add it to your favorites list. Once you have added it to your favorites, you will click the Add button to enter the historical information for this patient's vaccine. The vaccine is selected. The yellow fields on the form indicate information that is required. Update the form with the details provided. Note, if the patient does not remember the exact administration date, you may enter an approximation based on the information they provide. Clicking the Chart button updates the information and records the immunization. The vaccine is documented as a previous immunization. Reviewing the recommendations section of the chart shows the influenza recommendation as satisfied. This concludes the Acknowledging Outside Immunization portion of this tutorial. In this session, you learned how to access the immunizations history form on the patient's chart, how to add commonly given vaccines to a favorites list, how to complete the immunization history form, and lastly, you learned how to verify that a recommendation is satisfied by viewing the recommendations section of the chart.